Welcome and thanks for joining us for another episode of Silicon Slopes Live. I'm standing in for Clint Betts. My name is Dave Meekum, and our host, or our guest today is Dean Hume from the UofU Health. Dr. Hume, you're a dentist.
I am indeed.
And how long have you been with the University of Utah?
I think it's 5 years now, Dave.
Well, we've asked you to come on to talk about, and you and I were talking about this just before we went on, you know, what it's been like to be away from the dentist for a little while as we've dealt with COVID-19. And now, is it safe to go back to the dentist? We know that some of the regulations have been relaxed, but tell us, is it safe to get back into the office?
Dave, it's becoming safer and safer all the time. Initially, it was very, very wise that we did what we did all across the US. Dentists backed away from anything but absolute emergency care and took great caution with that, and that's been the right thing to do. But as we've learned more about the virus, we've discovered that we actually were very, very good at infection control already. There was one really very encouraging report from Wuhan where it all began. There's a giant dental hospital in Wuhan where they practice dentistry to US standards of infection control. And they didn't have any problems. So none of their staff or providers became infected. A few did, but they weren't actually clinicians. They just got infected because they were in the community. So it doesn't look like dentistry is a place of great risk. There are still some unknowns, but that was encouraging.
So when we talk about the risk of transmission from patient to patient or dentist to patient or vice versa, those odds are fairly low.
The odds are very low, particularly because since HIV, we've been practicing what we call standard precautions. Those of you who are older, or people who are listening who are older, may remember that before HIV, dentists didn't wear gloves. They operated with just their hands, and they didn't always autoclave their instruments. They would put them in chemicals to sterilize them. But when HIV came along, we realized that wasn't good enough. And there was a lot of intense research done on safety for killing viruses between patients so that we wouldn't get patient-to-patient transmission. Looking after surfaces, we learned a lot about virucidal treatment of surfaces. That's become absolutely standard. And the gloves that we wear, the masks, the gowns, all disposable. That's become standard in dentistry now. And those things work extremely well to prevent the transmission of virus between patients on visits into the same setting and between the staff and patients.
What do we know, doctor, about COVID-19 and specifically to dental risk?
Yeah, I've got to say we're still operating mostly on good general principle as we come back. There's not a lot of research data yet on the specifics of COVID-19 as a virus. But that study from Wuhan, plus our general principles on virus, mean that it really looks very safe. We haven't had any incidences yet in the US of any transmission from patient to patient or dentist to patient or vice versa in all of the emergency setting, all of the emergency care that's been going on for the last 2.5 months. So that's encouraging. We're studying it. Everybody is now. Everybody's following through with their patients to make sure that it's okay. We are at the U adding one additional step now because of the uncertainties. We are testing every patient before we see them to make sure that they're negative. And I believe that all dentists pretty soon will be able to do that. For us, it's the overnight, rather cumbersome, fairly slow, but very precise PCR test. But people in Silicon Slopes, for example, are developing a faster test. People are doing saliva-based tests now, which is much, much better. It's my prediction that within probably several weeks, not more than months, most dentists will be able to test. If we think a patient is positive, we screen patients by asking about symptoms, travel history when that was relevant, taking temperatures. We do all that. If we think somebody is positive, we send them away to be tested. Dentists can write the test. We're permitted to do that. It's within the scope of practice. So we're doing that. But increasingly, we'll be testing asymptomatic patients before they come in to increase that level of safety. It's pretty safe now. It will get even safer soon.
You must be clairvoyant, doctor, because that was going to be my next question.
Yeah.
Is what is the screening process that's happening for the dentist and the patients? But you just kind of went through that, so that's great, and I think that's going to add a lot of reassurance to patients as they come in and alleviate those concerns. Is the virus testing useful to increase safety?
Yes, we believe so. It's already very safe. We're coming into an environment where people do infection control on surfaces, where people do change their gloves, change their gown, change their mask between patients. That's very safe already. At the U, we're adding that extra step of testing everybody because we have patients who are considered high risk. We look after a lot of elderly people. We don't want them to be at risk from us. We don't want to be at risk from them. So we're testing them. When we can do that, and we can do that, fortunately, that will make it even safer. It's our very strong view from everything we know about general principle, our experience with HIV, and the high specificity of the testing that we've got now. We can make the dental environment as safe or safer than going to the supermarket, and it's very safe to go to the supermarket.
Yeah, it is.
The infection rates in those settings are very minute.
Right. What about specifically with regard to antibody testing? Is that going to be useful to increase safety at the dentist's office?
Only as a scientific tool to find out whether we were effective in what we were doing. It's not really a screening tool for patients or for providers. What will happen over time is that we will be doing testing on patients who've been with us to make sure that they're okay, and providers who've been working with patients to make sure that they are okay. And if there are any errors in our process, we'll find out that way. So that's really what the antibody testing is for. But it's the virus testing itself to find out whether somebody has active virus that can be detected and therefore they are at risk of passing it on. That's the principal test that we're concerned about.
Interesting. Well, this is all good news because there's a lot of people who, and I was one of them. I can tell you that in the middle of some dental work when all of this hit, and we've kind of been pushed off. We need to get back into the dentist. We need to take care of our teeth, and it's good news that we can get back.
Yeah, initially that was wise. It was wise for us all to do that in the early days, and we did that. We decreased our patient flow by more than 90%, and we said only emergencies if you're in trouble. Now we're saying, if somebody like your situation, we need to finish that crown, we need to finish that root canal, otherwise it's going to go downhill. The risks are now low enough, we're very confident, and the benefit is high enough. I'm concerned that people will be putting off things like routine scaling and cleaning, and their gum health will be going down. That's not a good thing to do. It's better to say, okay, we're now safe enough to come back into that setting with all of the precautions that we do and maintain our health. I think there's more risk to an individual, even from slowly progressing dental disease, by not having that looked after than there is by going into the setting.
Well, that's good news. So no reason to put off your visit to the dentist. It's safe to get back, get that work done. It's the risk has been mitigated to a large extent. So they're screening, all kinds of great things going on in the dentist office. So get in, get your work done. Dean Hume with UofU Health, thanks for joining us today. It's been really enlightening and great to talk to you.
A pleasure.
Have a great one, and we will talk to you next time.
Okay, thank you.
Bye now.